Your chief complaint is hip discomfort. Is it right or left?
Sometimes it can be both. I sit like this a lot at work, and I'm always wearing heels. So near the end of the day, it'll be like both of them back here. I just feel like I kind of need to decompress it. But I've had that for a long time. Plus, my hips are like a little bigger. I don't know if that can contribute to it, but
Well, sitting cross-legged like this as a woman, it is kind of like you're all day like this. It can separate the SI joints, which is where you're pointing. Is it in your hip joint or is it in the back?
Well, I do have lower back pain as well. So if I sit a lot, I get that combined with like the hip discomfort down here.
So you do feel it. Do you mind if I press like right here?
Yeah.
You feel it in there as well. Okay,
Yeah.
So it could be a hip socket or a low back. It could be both. So I have to kind of figure out which one it is. It could be radiating from your low back into your hip, or it could be because you're crossing and the hip is overextended and it hurts.
Okay.
I sit like this, but not for very long. You will sometimes see me like this, sitting forward. Do you still have neck pain then? Does it come back?
Sometimes it's I try to sit as straight as possible, but of course when I'm down on my phone, if I sleep wrong, that kind of thing. But it does feel tense. It feels tight.
I'll just take a couple, like march in spot right there and stop. Nothing unusual so far. Right lateral pelvic shift, left high shoulder, right lower shoulder. This is all 80% of the population. Nothing is unusual here. Turn to the side. This tells me how I'm going to adjust you.
Okay.
And then like we look to see whether how far forward the ear is from the shoulder. You're not too bad, only about maybe an inch. You have a little bit of a loss of curve in your neck. It should be, more like this. Okay. What I am noticing is some major...
Yeah, that's always rock hard.
Ow. Yeah, maybe we should go a little lighter on you there. Wow.
Well, it's always... I try to get massages often to loosen it up, and it does help, but I'm just naturally very tense in that area, I guess.
Yeah, your shoulder joints feel fine. If you are nervous, the adjustment doesn't feel like much of anything.
I know. I remember it not being a big deal at all. It's just it's been so long.
So you're kind of like,
yeah.
Oh no.
Yeah.
It makes a loud pop.
Yeah.
And it's like cracking your knuckles or cracking, your ankle when it pops. Does it hurt? Not really. No. All that does is it gets more range of motion in your neck so that the muscle isn't pulling. Okay, yeah. So when the bone is locked like that, it swells up, edema forms. Ow, a little bit of pain here.
Yeah.
You're not really feeling that much discomfort up here. You're like, no, it's all the shoulder. That's more of a muscular problem. But if I don't get the bones where those pieces of muscle attach to move, it sprains in the middle. And it kind of tears in the middle down here.
Okay.
And it will keep tearing and keep spraining until we get these guys moving. And so what the adjustment or the pop does is inflict a motion, joint mobility into an area that's not moving. And these guys don't generally move because over the years they've been having to hold up your 15-pound head and they don't like to move. So what happens is lower neck moves too much. Upper neck don't move at all.
Well, the upper neck on this side, with you touching it, I can feel it now.
I know. Now watch, up here on the left will be sore.
Oh.
Yep, okay. You're classic though. I know exactly where they all are going to be. You're going to be fine. Crazy. You're going to feel better afterwards. You'll be okay. Cool. There we go. Okay, just breathe through this. Start you off easy. Checking all the different muscle groups. A little bit of tension there. Again, if anything is too much, you gotta let me know, all right? I do not have to put you through more than what you can handle. You've got great flexibility.
Thank you.
Yeah, nice flexibility. I know, a little trigger point down there.
Yeah.
Put pressure on it and hold. Too much?
No, it's like
good kind of pain. It's like, I know you're undoing it, so it's like, spare it.
Oh, I know. I got a lot of muscle in these hands.
Mm-hmm.
Been doing this for a long time. Okay. Ouchies.
Yeah. It's crazy. I feel that like at the top of my head.
Yeah. Mm-hmm. Suboccipital muscles. Whole lot of nerves in there. It's my job to know where all those nerves run. So it's going to be a little bit different than a massage, okay?
Mm.
More nervy. Perfect. That's it. Excellent. Just a waiting game. There it goes. It's starting. It's starting to give up. Well, there's nothing left. Great. I know what you mean.
No, it feels good now. Like, it's crazy. Whatever you did just got rid of
The soreness, yeah. Now I gotta do this left-hand side.
I can already feel the difference between the two.
Yeah, can you feel how this side hasn't been worked on?
Yeah, the other side's great.
Yeah, so here we go. Oh, there it is. And there they go. Still a little bit of swelling right here. I'm gonna check it one more time, see if you can handle it. Yeah, it's perfect. You ready?
No.
No. Oh. No. Let's leave the pecs here. Get those loose. It's about as loose as I can get it beforehand.
Okay.
I'll do a baby adjustment, okay?
That's fine.
Just a baby one.
That's fine. I'm just being a wuss.
Oh, no you're not. This is, intense. Here we go. That wasn't bad, see?
That was awesome. That was so cool.
Very gentle here. Here we go. Chin back for me. Yep.
That was so cool. Wow.
That's all that is, okay? It's not a big deal. Oh, that's so much better. Wee! It's like whoosh.
That was crazy. There was no pain in that at all.
Okay. One more at the top. I'm not going to adjust it, just holding it. Just a little bit of edema still right here. That's it. That's why I said the adjustment's the easy part.
Mm-hmm.
This is the hard stuff.
Yeah. I can see now.
But it makes such a loud noise, you think that it's going to be like...
It's like, oh man, she
painful.
broke me.
Yeah, yeah, but it's not, I promise. Okay. I'm going to let that sit. We're going to do the feet. We're going to just let you relax there, okay? Let that blood drain from your neck. Now, are you on your feet a lot?
It really just depends on the day of the week.
I feel your naviculars like dropped a little bit here, so take care of that. Okay, I forgot to warn you. Popping time, popping time.
No, I'm not even worried about you warning me. It's just crazy you feel all these pops everywhere.
I'm sorry.
No, it's
Here we go. Feet, ankle. Here's a little baby one. Baby one. And then knee. Now the hip, okay?
Mm-hmm.
Any soreness when I do this? In your hip at all?
Nope.
Not here?
Nope.
Nothing here? Nothing in the hip. Okay. So I'm going to grab your whole leg here. There's the hip.
That's cool.
Piece of cake. That was everything in one shot there. Here we go again, hip. Your hips feel just fine. Okay, they're moving like like nothing.
Okay.
So I'm not worried about them. Yeah, everything just feels like it's falling into place and not really having to work too hard. Okay, so now we're gonna be on your stomach. Ooh. Oh man. It's like, can I just crack this right now? I mean, you can just see the curvature here on her. Take a deep breath in. Oh, yeah. All right.
That was good.
Okay, deep breath in. All the way out. Piece of cake. You can just see this is more prominent here. To, wow, to right here. See, now it switches on the other side. Deep breath in, all the way out. You're so easy. Like, how much more do we have? Okay, I think we're done now. Now that is a short right leg. Definitely. That's like a whole half an inch. Yeah, no. It goes long. I don't know if you can handle this. Let's see. How's this feel?
Good.
Right here is where you're carrying most of your tension. On the right hand side here. You've got it, you've got it. Okay, can you see that, Linnea, at all? I don't know if it shows up here. Just got like 2 out right here, 2 out, and then 2. Not much on the left, except right at the top. All right. Oh, look at that. Ow. Is this hurting you too much?
No, it's like a good kind of pain because after a while it releases.
Yeah, it's pretty, just a lot of tension. You know, you hold a lot of tension.
It's life.
Life, yeah. Who doesn't? I take you just to the edge, and then we stop. It's kind of weird to see a mouth over here. It's like, what?
You don't see that every day.
Nope. Yeah, and you can start to see I can start to see petechiae coming out. That's just where you're really swollen. Get some more range of motion in there. Just breathe. I know you're holding your breath. That's it. I told you this left side. Is that where it hurts?
Yeah.
Oh, okay. I'll go later. I'll go later. Dad, don't hold it in. Let me know.
Wow.
That's too much.
No, it's like crazy how that even hurts.
Well, when you say it wraps around into the hip, I know that it's right here. Okay,
Yeah.
I know that there's a muscle or a knot that's tight. And yeah, there it is.
Oh.
Boop.
Ouch.
Let me get it. Let me get it. It's a weird feeling. It's a weird sensation.
That's crazy. Ow.
There we go. There we go. There we go.
Sorry.
Tickle?
No, it doesn't tickle. I don't know why I'm laughing.
Yeah, just feel that. No wonder you have hip pain. Dear Lord. All right, down the back of the leg, okay?
Okay.
Whee, into the hamstrings. Come on, there you go. You're so little. You're just so tiny. You're like your little feet and everything. I'm sorry.
It's okay.
It's like it's just real quick, you know, to go through everything.
I get that a lot.
I had tall people like 2 days ago, so I was like, you know, I'm like, ooh, and woo. You it's just like, your muscles are like, you know. Oh, there we go. This side isn't as bad.
Yeah.
No.
No, it isn't, but it's still, you still feel it.
Okay, so this is the SI joint right here.
Mm-hmm.
There's 3 joints of the pelvis. Here is one right here. So there's one here that we already worked loose. Should feel pretty good now.
Mm-hmm.
This one I haven't gotten yet. All right, so we got to start at square one. If I want to move this, I've got to work.
It's okay.
Her fist is like this. It should feel like it needs it, but at the same
Yeah.
time, it's not that comfortable. You're right.
Exactly.
You can feel the release. It's just
Yeah.
going through it is not fun. I know. Almost done. It's almost there. It's getting softer. Hold
Yeah.
on. One more.
No.
Okay, done. Down the back of the leg, okay?
Yeah.
You're like, whatever. Just fix it. I don't feel much in the back of the leg here. That's all the adhesions. Ooh, and you got a massive one right here.
I almost fell asleep in that. My face down.
Oh.
It was good.
Ooh. I'll take it slowly because it's kind of deep in there. I know you said the right side, but man, this left-hand side is something else. So what size gauge is that?
I think it's a 0. I've had them for so long. I forget. I haven't measured.
The largest I ever went to was a 12.
12. Yeah, 12 is pretty big.
Somehow they sort of went down, but not.
Mm-hmm. They can. It really just depends on, the state of health your skin is.
Mm-hmm. Well, it's the same thing with this. People ask all the time, when does this go away? The
Mhm.
petechiae, about 4 days. Depends
Yeah.
on how healthy you are. I'm gonna stabilize you here, that's all.
Mm-hmm.
That's a bad one. take it a little slowly. This one's bad too. Hold your head a little bit to the side. I've got you. Come on, little guy. It's like, come on. I feel it pulling all the way up into here. Shoulder up for me just a little bit. Get through it. Okay. Phew, you did it. I know.
That was good. Thank you.
Oh, we're not done yet, but we're getting
No,
closer.
no, but I already feel like,
It's working.
yeah.
I'm like, I can just see her second rib here is more prominent. Now the heart is there. Yeah, I just kind of hold the wing on the backhand side so I can get a little deeper. Tricks of the trade. Then we go to the front here. Whew, there it is. Nice. Yeah, so the adjustment is just joint mobilization.
Yeah.
You got to get front piece, top piece, back piece,
Yeah.
side piece. I don't hurt your arm. So I asked you before, how's
No,
your
you're
arm
okay.
doing? Because I'm back here. I know, I'm over here now. This arm like just kind of rested on top of your head. So I'm going to grab this. Here we go. Oh, there's a huge knot there. Maybe we should have gotten her face.
Yeah. No, you don't want to see my face right now.
And you're wondering why your shoulders hurt. Dear Lord.
Yeah. It's crazy. You never know how tense you really are until you get something like this done.
There it goes. Phew, other side. This is your sore side, I know. Just breathe, you got it. That side wasn't as hard. Is that real sore though?
Yeah, it feels sore. For some reason, the other side felt a little bit more sore.
Yeah, I'm not really feeling it over here. This table, we've got plenty of room now. Before, people were like, I'm gonna fall. So you shouldn't feel that with this. Bottom leg straight. This is your posterior side. I'm gonna roll you back this way. Now your body, scoot your head backwards, like look back. That's it. Perfect. Stay there.
That was good.
Yeah, it should feel like a release. Yeah, it's. She's got a really big knot right.
Sorry. Sorry.
No, you're fine. This is why her hip's hurting. You gotta use a foam roller, you know, and kind of roll these out. Or go into your Zen moment and let me do it. Yeah, this is why your hips are hurting. I'm sorry. That feels pretty. What it is, you're really flexible. Your joints are just like really poppy clicky.
Mhm.
And then you've got muscle around it that's just like, no.
Mhm.
So your joint moves before your muscle does.
Yeah.
You know, when I went to adjust your back, that was like no problem in the world, but then getting rid of this knot.
Mhm.
Down the IT band, kind of sore. Legs sometimes are worse than anything.
Yeah.
almost about halfway. 75. That's it. That's it. The last one should have felt like the easiest one.
Yeah.
Yeah, that's the okay. Now we're gonna flip over on the other side. Now this side, my contact is gonna be a little bit lower here. Okay, so I'm pushing this way. So it's gonna be a little bit. You're not gonna fall. You're right here, but I do have to kind of get over you. Oh, you're really, really like Gumby. That's all it's gonna go. Perfect. Whew. Done.
I laugh because I'm trying not to
Flinch and kick me.
Yeah, well, I want to push through it because I know it's gonna help.
Well, you got a large, like your ID band. Yeah, I haven't hit it yet, but I'm about to, so this might not feel the greatest, but I'm going to do it like 3 times and then whatever I can get, I can get. Okay, ow. They're huge, not there. One more and I'm done.
Oh, that was probably the worst out of everything.
There you go, both knees bent. Now we're going to relax the IT bands here. You've probably seen this one. This is the front pubic symphysis.
I think so, maybe.
You're going to press out with your legs against my arms. So press outward. You're going to feel your little pop in your hips. Push out more. I'm going to resist. Feel some pressure in your hips. Up. You're going to adjust it yourself. Yep. Okay. Now you're going to squeeze. Squeeze a little bit more. A little more. More, as hard as you can. Okay. Ready? Squeeze. There it is. Perfect. How you feeling? Okay?
I'm good. I feel very limber, like very loose already. But no, I just feel good. I feel aligned.
That's what it's supposed to be. Come
Yeah.
on up for me then. You're so loose that
I'm gonna go home and take a nap.
that's how you should feel.
Yeah.
Like you've been through the ringer, but no, you're you're so loose. Like you got a little bit of hyperflexibility, in your
Yeah.
joints. See that? A little
Yeah.
bit, yeah. So that means I don't need to go so hard. You'll know when something is out.
Yeah. That's crazy.
How are you
Thank
doing now? Is it feeling good though?
Yeah, no.
How's your shoulder?
Very good. I feel like it's not tight.
Not pulling anymore.
Yeah, not pulling, yeah.
Okay. This is the final one. And then that arm up and over too. Perfect. You're gonna stay like that for the rest of your life. Bend your knees for me though. Bend. There you go. That's your exercise right there.